a sexual and reproductive health consultant, as well as the founder of Pink Clinic Nigeria. So I bid you a good evening, Dr. Linda, and I trust your day has been good.
Good evening. Yeah, my day has been good. Thank you very much. How about yours?
Oh, my day has been great. I'm excited that it rained, and then the weather is awesome as well. So hey, it's a
Yeah,
win
true.
for me.
Mm-hmm. That's
And
correct.
yes, so you can actually join, and what you want to be a part of Smooth Health this evening, you can actually send us your thoughts via our WhatsApp platform on 0809 4440981. That's on WhatsApp. However, if you also want to join us live and watch and figure out what we look like, well, you can go to our YouTube handle. We are at Smooth 981 FM. So you can, figure out what Dr. Linda looks like. Yes, in her beautiful pink dress. And yes, all smiles as always. And she'll be giving us more insight and sharing. Well, if you have questions as well, you want to figure out with regards to uterine bleeding, what exactly it means, and all the likes. Well, she's here to give you more insight into that. And talking about insight, let's delve into it.
Yeah.
Let's even start with the basic, right?
Mm-hmm.
When I saw this, I was like, not every female will understand where this is coming from, but at least they need insight and need to know how to handle things better. But what is your typical duration of a normal healthy period? Let's even start.
So a normal healthy period should be between 3 to 7 days. So if you're bleeding and your period is 3 days, it's fine. 4, 5, 6, 7 days is also fine.
Okay.
So that's how it should be. Your normal period should be between 3 days and 7 days. Some people get excited. Well, maybe me, when I was much younger, I didn't know. When I was in the world, I didn't know what it means. So when you tell me about menstrual period, I'll tell you, oh, my period is just 2 days, and I'm excited. There's something wrong. And if you bleed for more than 7 days, there's something equally wrong. So if you're bleeding, it's between 3 to 7 days, you're good. If you were bleeding 5 days before, and then now you start to bleed 6 days, 7 days, it's still okay because, as we get older, your body changes due to stress, hormonal fluctuations, daily activities, monthly cycles, and all that. So your period can change. But if it falls within 3 to 7 days, you're still good.
Well, at least now we know better, because then, like you said, once you don't see the period come as younger girls, you're like, you're excited. You're like, freedom at last.
Yeah,
But you never
like,
knew
my
that there was.
period is not too. Exactly, we're happy. Once we are sure that we're not pregnant, we're very happy that the
because you weren't active. So yeah.
Yeah,
What were
so
you
the period
looking
is not
for?
showing.
Yes.
Exactly. So, but now that we know better, once
Yes.
there's no period, you need to worry. Like, you really need to worry. It means there's something wrong, because the healthy menstrual cycle is a cancer-free future. If your menstrual cycle is not healthy, you have your period today, you don't see tomorrow, or you have it next tomorrow, or your period keeps coming. We've seen people at the clinic that have prolonged menses. They'll tell you that I've been bleeding since January till date. And they're not kidding. They've been using pad every day. That's definitely a problem. Some people say, oh, my body is washing off bad blood. There's nothing like bad blood. I've said that before. There's nothing like bad blood. There's nothing bad about anybody's blood, right? Okay. So if you're bleeding for more than 7 days, there's something wrong.
There's a problem.
You need to see a doctor as soon as possible. Don't even keep it. Don't even wait. You need to see a doctor as soon as possible. We can't categorically say there's a problem in the first month. We'll watch it by the second month, and by the third month, if it still persists, then there's certainly a problem that you need to address.
Okay, so now let's even get into the topic proper, which is dysfunctional uterine bleeding. What exactly does this mean? And at what point should one be, looking out for symptoms?
So dysfunctional uterine bleeding, as the name implies, dysfunctional, something that is not normal. Uterine bleeding is shedding of the womb. So the uterus is the womb. So when you bleed from the womb and the bleeding is prolonged, or the bleeding is irregular, or the bleeding is excessive, that's a dysfunctional uterine bleeding. Like we said, like a regular menstrual period or a healthy menstrual period should not exceed between 3 to 7 days. However, if you bleed and you soak more than 3 pads a day, even though your period is 3 to 7 days, or you soak more than 3 to 5 pads a day, that is a dysfunctional bleeding. A healthy period, if I change my pad in the morning, because I want to be clean and smell all fresh, I can change at noon and then decide to change in the evening when I have my shower. But it shouldn't be more than that. If you have to change every 2 hours, some people say my period rush, I change every 2 hours. That's a dysfunctional bleeding. That's not normal. So even if you bleed within the stated duration, but you still soak more than 4 pads a day, it's dysfunctional. There's something wrong. Dysfunctional uterine bleeding is bleeding that happens to women that do not ovulate, regardless of whether they have medical illness or not. Yeah.
Oh, okay. I think at least now that clears the questions as to so what are the things you need to be looking at for, but what are the primary causes of this abnormality when it comes to uterine bleeding?
So first of all, sometimes we don't even know what happens to women who have dysfunctional uterine bleeding. Sometimes there are no underlying causes. It just happens. Research has shown that 3 out of 10 women once in their lifetime will experience that phase. But once it becomes prolonged, there's certainly a problem that we need to look out for. And sometimes it's hormonal fluctuations. Like I said, as we grow older, our hormones changes due to stress, mental stress from relationship, heartbreak, from financial dollar rising and all that.
My goodness. all that can actually affect us. Wow. That's interesting to know.
So all that can stress you out and you're thinking, oh my goodness, I need to pay for my school fees. What am I going to do? Or my house rent has increased and, how am I going to sort it out? All those things can make hormones fluctuate. And as your hormones fluctuate, when it becomes prolonged, you can have what we call dysfunctional uterine bleeding. For some people, it is triggered by growth in the womb. It could be fibroids. It could be anything that's a growth in the womb that can trigger it. For some people, it could be infection. But majorly, hormones have shown to be the major cause of women who bleed excessively to have what we call the dysfunctional uterine bleeding.
Okay, that's good to know. So, yeah, some scary things just, came through my, just came through my head, and I'm like, you know what, stay away. Because you mentioned fibroids. There's usually the notion that some people, some school of thought are always of the opinion that once a woman has fibroids, that's when her periods become extremely heavy, and then this is what she will have to pass through for the rest of her life, unless she has to go through surgery. Remove them. So that can be.
So not every woman that has fibroid experiences dysfunctional uterine bleeding or heavy bleeding. Some people have fibroid and they don't even know until they go and do a scan or an ultrasound that shows that, oh, hey, madam, you have fibroids. And it also depends on the location of the fibroids and the size of it. So not everybody who is diagnosed to have uterine fibroids experiences dysfunctional bleeding. Like I said in my definition, dysfunctional uterine bleeding can happen to any woman, regardless of whether they have a medical condition or not. So sometimes it's not triggered by the physical features of fibroids and all that. Sometimes it's just hormonal, and sometimes we don't even know why it happens. It just happens, but we'll treat it anyway.
At least there is, so that is the caveat there that I'm actually happy about, that there's a treatment at the end of the day. It's not like we're going to just be stuck with that situation or that problem and not find a way out. But I definitely want to know how what it is, or how it is that gynecologists or doctors in general actually find out or are able to, help diagnose uterine bleeding. Let's quickly go for this quick breather. On the other side, I want you to address all that and more, as we will be talking about dysfunctional uterine bleeding. So Lagos, don't go nowhere. Let's take this quick breather. On the other side, we'll definitely be talking more on smooth health. This is Smooth Health on the Drive. So we have just 3 minutes and we'll be back up.
Okay.
Yeah. But yeah, that I like the fact that I'm grateful that you were able to clear that, because that whole fibroid thing, most people just, when they go to the hospital and hear all that, they're like, if you have fibroid, that's the end. That's the end. So it's good to actually clear that out.
Oh, most women have fibroids. A lot of women have fibroids.
Well, how is it that?
And it's not the end, because fibroids are not cancer growths. They're just benign growths that can be removed and you can keep back to normal life. So it's nothing.
How some grow like they grow in leaps and bounds, let me put it that way. And while some are so tiny and inconsequential.
Yeah. So fibroid is usually influenced by your hormones, sometimes your lifestyle. So because in Africa we eat a lot of carbs, rice, eba, we eat the same thing. What have you eaten today? Tell me, Joy.
Okay, I've had yam and eggs.
Okay, yam and eggs.
Yes.
That's all for today.
That has been all. In the evening will be more veggies and fruits.
All right, that's fine. So some people will do yam and eggs, then in the afternoon they'll do rice, then the night they'll do semo.
That's a no-no.
So yeah, and that's why they say have a balanced diet. Those white guys that say you should have a balanced diet, they knew what they were talking about, because you need to balance your meal. So food high in carbs have been shown to increase the growth of fibroids. And in Africa, because our food is majorly carb, fibroids will be growing so much.
All right, let's get back into the conversation. Oh my goodness. All right, 32 minutes gone past 5. And this is the second half of Smooth Health on the Smoothest Dial on Radio Smooth 98.1. And we are discussing dysfunctional uterine bleeding. And my guest this evening is none other than Dr. Linda Keku. She is a sexual and reproductive health consultant, as well as the founder of Pink Clinic Nigeria. And talking about, uterine bleeding, dysfunctional uterine bleeding, she's actually giving us some insight as well. But I know that I'd asked with regards to figuring out, especially from the doctor's side of things, how do you get to diagnose uterine bleeding? What are the processes that you go through?
Yeah, so we when the client comes to the clinic, we look at their symptoms. Okay. They come with excessive bleeding, they come with irregular bleeding, they come with prolonged bleeding. Sometimes they have what we call anemia. Anemia is because they've lost so much blood. You expect that they're looking pale, and by the time you check their blood levels, it's low. And then we do some screening. We check because there are other things that could present as dysfunctional uterine bleeding. If your thyroids are imbalanced, if you're having an infection, if you have an ectopic pregnancy, or if you just lost a baby, miscarriages, we need to check for all of that. So when they come to the clinic, we're doing pregnancy tests to rule out pregnancy. We'll check for their hormones. We'll do an ultrasound to see if there's any growth, because fibroids can cause them to bleed that way. We'll check for PCOS, because women with PCOS have such symptoms. And then we do their blood work, check their blood levels, check that there's no infection. We'll do a cervical cancer screening, because an early stage of cervical cancer could be profuse bleeding.
All right.
Or even ovarian cancer. So we check all of that. Once everything is given negative, and there's nothing wrong, we just classify it as dysfunctional uterine bleeding. But in most times, you see that their hormones are a little bit imbalanced. Then we start to treat hormonal. So if you're listening to me and you're experiencing excessive bleeding, heavy bleeding, sometimes lower abdominal pain, and you've gone to the hospital and all your results are still showing that there's nothing wrong.
There's nothing wrong with you.
Yes, it's classified as dysfunctional uterine bleeding. You still need to go back to the doctor. You need to see us at the clinic so we can give you medication to stop that, because you can't be bleeding for so long. We've seen people who have come to the clinic and say, I've been bleeding for 2 weeks. 2 weeks is even early. I've been bleeding for 1 month. I've been bleeding for 2 months. Some people see their period twice in a month. So when you're supposed to be ovulating, you are bleeding. That's a dysfunctional uterine bleeding. When you're supposed to be bleeding, it comes, but it's prolonged. So instead of 7 days, you are bleeding for 10 days more. And sometimes it may not be heavy, it could come as spotting. But every day you're seeing blood in your underwear. That's a dysfunctional uterine bleeding. And you should not keep silent over it. What you need to do is to come to the clinic immediately and to see the doctor so that we can be sure of what is wrong. Like I said, it could mean anything. It could mean thyroid issues. It could mean fibroids. It could mean cancer. It could mean infection. But we would not know until we check. So you need to come for a physical examination and also a clinical examination for us to be able to be sure of what the problem is.
All right. Don't forget that you can as well be a part of Smooth Health today by sending us your questions on 009-444-0981. Any question at all will be actually addressed by Dr. Linda. And Keju comes through and is asking, what if the heavy bleeding is only for 1 day during a 4-day period? So
someone is asking, what if what?
It's a 4-day period, right? But on the first day, or one of the days within the 4 days is very heavy. Is that normal, or should she be worried?
So when you say heavy, I would like you to quantify how heavy. Remember, I said something. I used the soaking of your pad to be able to quantify how heavy your period is. If you are soaking 2 pads in a day or 3 pads in a day, it's still normal. And it is very normal for when your period is about to start. Remember, what happens is that your womb gets thicker than normal. So on the first day, you're trying to shed it. It's expected that on the day 1, it will be heavy. For some people, their day 1 is very mild. Then day 2 it becomes, a
flood,
boom.
More or less.
A flood. It becomes a flood. Then day 3, it starts to decline. And by 4, 5, you're good. So if you have normal duration, first day, you're soaking 1 or 2 pads, it's still okay. When I say dysfunctional bleeding, I mean from the first day to the end of your period, you would have bought all the sanitary pads in the supermarket. Like you have a box load of pads. I've seen people tell me that during their period, they use 10 sanitary pads.
Okay.
They use 3 is like, okay, some people use up to 10. And some say they use 10. So that's like if you have 6 pads in a pack.
In one pack.
So you have used 6 times 10. That's like 60 pieces. That is really ridiculously much, right? We've seen that a lot. And when you see them at the clinic, they look tired. They have headaches. They are exhausted, and they look pale. There's something wrong, and it needs to be checked.
All right, Pedro.
So I hope I was able to answer the question of the person that asked.
Well, Pedro says it's usually on the first day, but she hasn't also indicated how much pads she has to use on the first day. So
I'm sure this person writing is fine. I don't think you have anything. So if you are bleeding heavily on the first day, I think you're good. You don't have anything to worry about.
Okay. All right. So how frequently should a woman address questions regarding, or if she finds that she's having dysfunctional uterine bleeding, how often should she go to the hospital for checks and figure out what's really happening with her?
Usually when you present to the clinic and there's a dysfunctional uterine bleeding, if it's the first time it's happening, we usually do nothing. We'll just encourage you and reassure you and tell you to watch what you take in, maybe start to exercise, watch your diet, reduce fizzy drinks and carbs and all of that. But if you continue for after first 3 months and you're still having the same symptom back to back, so we'll place you on a 6-month treatment. Usually the treatment is not one-off. We place you on something that you should use for 6 months to 9 months, depending on what we figure out as the cost of it. you're having and the symptoms you're experiencing. If it's heavy bleeding, if it's prolonged bleeding, that will determine what kind of treatment we're going to be giving to you. So if you don't have a symptom, you don't need to come to the clinic to have a check or anything. All you need to do is just to, continue with your healthy lifestyle. If you have symptoms, as long as as you have those symptoms, you can come to the clinic to have a check. And then remember, you're going to put you on medication for 3 months to 9 months, depending on what symptoms you are manifesting with. Yes.
Okay, that's good to know. But so my major question really is, what are the effects of this heavy bleeding? I know you've mentioned how some individuals are usually very weak, tired, they're anemic, a lot of other things. But what are the effects does this have on a woman's menstrual cycle?
Okay, so the first thing is, first off, they are very pale and exhausted and tired. Secondly, it affects their relationship. Imagine me having to bleed every time throughout my menstrual cycle. And if I have a partner who wants,
that's going to be difficult.
That's going to be difficult. And so they are usually unhappy when they come to the clinic. They're usually very unhappy. They are exhausted. Their partner, of course, is not happy that they are bleeding all months and he can't have a feel of their woman. So they're usually mentally not happy. And sometimes they come down with infection because they have to wear pads all the time. So they usually have vaginal itching, vaginal discomfort, discharges that, that would have been as a result of use of pads for a very long time.
Period.
Yes, and they feel very tired and exhausted even at work, and it affects their general day-to-day activities.
Now that can be a letdown and indeed worrying. So it's best when you find yourself in that situation, get to the hospital ASAP. So that you can have it
ASAP. Yes. And then there's some people, when they come to the clinic, they come so late. They would have had this I've seen someone say that she came to the clinic and she said she has been bleeding every day nonstop for 4 months. And I'm wondering, why would you put yourself through that?
4 months.
She said, so she said they told her that it happened to her mother, so it will happen to her. So because it happened to your mother, there was something wrong with your mother, obviously. But maybe because there was no medical intervention, she didn't know. So she was busy taking herbal medication and forgetting that she had to do a checkup. By the time she presented to the clinic, everywhere, the vulva and the vagina was so reddish. We had to start managing for infection. She was pale white, blood transfusion had to be done and all of that. So if you're experiencing dysfunctional uterine bleeding, it's not something to wait. It's not something to watch. It can be something else. It could be very detrimental to your health. And also, we need to know the underlying cause of it. So if you are experiencing that, you need to report to the clinic as soon as you see that this period is no longer 7 days old. What's going on? And it has happened for the second and third time, you need to present to the clinic.
Please do not take your health for granted. It is important to always make sure that when you find something amiss, go to your doctor so that you can get a clean bill of health, as opposed to waiting until it's the final stage and you can't be helped. So it is key to just do that. But I know that you said immediately you find yourself in a certain position, you need to just go to the hospital ASAP, right? But what are the complications that are associated with dysfunctional uterine bleeding? And how can you just regularize your menstrual cycle at the end of the day?
So with dysfunctional uterine bleeding, you will almost always need a medical intervention for your menstrual cycle to come back. And there are different medical interventions that can be done depending on what the problem is, right? Drugs can work, some medications can work. Sometimes we give hormonal contraceptive. Some people don't like to use contraceptive because they feel that there's a lot of myth around it. But guess what? we use those contraceptives to treat problems, gynecological problems like dysfunctional uterine bleeding. So the hormonal implant or the pills or what we call the hormonal intrauterine system usually has been very helpful to us in the clinic to treat women with dysfunctional uterine bleeding. So I cannot joke with that at all. So, and sometimes too, when those things don't work, then we need to do what we call a dilatation and curettage, where you have to curate the woman's endometrium if they are way thicker than normal to get her back to life. And those ones really makes their treatment even very fast, right? So treatment usually depends on
the individual,
the duration, and how heavy this period is. So the first thing we need to do is to examine you first and find out what the problem is, establish that and the kind of dysfunctional uterine bleeding that you have. Then we can now follow with so many treatments that are available. So many treatments are available.
And you said,
be afraid. Sorry?
I like the fact that you said that there's so many treatments available. So people be afraid.
So many. Because when people hear, so as people come to the clinic and the first thing they say, am I going to die? Do I have cancer? No, not every bleeding means you have cancer. I mean, it's good to check that there's nothing like that, but not every bleeding. I mean, you can't just have cancer, right? So not every bleeding means that you have cancer. So when you come to the clinic, don't be scared. Some people will not come to the clinic because they are afraid of what the doctor will tell them, you know? So when they say...
that is a problem.
Yes, that's the problem. You see someone suffering, and I say, why are you not going to the hospital? Why are you just coming? I was afraid
of what the doctor will say.
So which one is better? Is it not better I tell you and make you get better on time? And for you to stay there and be dying in silence, my people, please report to the clinic, all right? And this thing, sometimes they don't even take long to manage. They don't take long. Like, they wonder, why did I have to bear this for so long? We've had treatment of dysfunctional uterine bleeding for a very long time, and this thing doesn't take so much time. Once we've established what the problem is, we'll place you on treatment. Within 2 weeks, even before 2 weeks, you get yourself back. So imagine suffering for months for something that would have been taken care of in just 5 to 7 days. So you don't need to wait, or you should be afraid of coming to the hospital. Especially in our clinic, we don't bite, and we make our clinic very cozy so that you don't feel like,
you're
don't
actually in the hospital. Yeah, I get that.
So that we can give you the best care, because we need you to also cooperate with us. And if you're not mentally there, we can't get the best from you.
Thank you so much for all that insight. But how can people get across to you? Say they, because I know some people want to ask further questions, maybe just shy to put it all out there at the moment. But how can they reach out to you on your social media handles?
So it's at Pink Clinic NG, at Pink Clinic NG. We're on the X, we're on Instagram.
Yes, X on Twitter. I know some people are still trying to figure that out. Yes.
Yeah, and we're at on TikTok. So if you're on any of those pages and you don't see my face, that is not my page. And on Pink Clinic on IG, we have the blue tick there. So if you don't see the blue tick, that's not my page. If you don't see my face there, that is also not my page.
Okay.
So at Pink Clinic NG, at Pink Clinic NG.
All right. So Pink Clinic NG on all platforms, and you will definitely get access to Dr. Linda Keku. Thank you so much for all that insight that you've given us today. I trust that when we reach out for further, insights on health, you will definitely come through and share insights.
Oh, yes, I'm always available.
Thank you.
Always available. You know how we do it, right?
Yes, indeed. Okay, Lagos, thank you as well for being a part of Smooth Health. It's always a beautiful time to, talk more about your health. Thursday, next week Thursday, we go again and talk about our health. But in the meantime, got so much more lined up for your listening pleasure. So don't go nowhere. Stay tuned to Smooth 98.1.
Thank you. Are we done?
Yes, we are. And what a great session